everyone, and welcome to today's Women's Health Tech Wednesday. I am your host for today. My name is Ansley Bowen. Before I get started and introduce our guest for today, I wanted to go over a couple of quick announcements. We have our New York City Health Innovation Week coming up May 5th through the 9th. You can scan the QR code, and also the tickets will be in the chat as well if you're interested in applying for tickets. We also have our HIT Lab Breakthrough Alliance Challenge that is open. We are accepting applications until April 12th. So make sure if you have an innovative healthcare solution and you want to apply, like I said, applications will be open until the 12th. We also have our Age Tech Collaboration Challenge from AARP, Age in Place. So if you have a solution regarding aging in place, make sure you apply now. The link will be in the chat shortly. And then last but not least, we also have our March Symposium tomorrow, where we're focusing on nutrition, social work, and the review of hymns and Vive. So if you'd like to join that and listen into some great sessions, scan the QR code or also use the link in the chat. And without further ado, I would like to welcome our guest, Lina Forcier, who is the CEO and co-founder of Factually Health. Lina, thank you so much for being on today, and I would love if you could give an introduction and background to our audience.
First of all, thank you so much, Ansley and HIT Lab, for this opportunity. I'm really happy to be here, and I'm really happy to share, because for me, in the past, when I've heard other people share, I've learned a lot of things. So hopefully some of the stuff that I'll share will be useful to some of your audience. So my background, did you ask about my background just now?
Yes, that would be great. Yes.
So here we go. I'm an epidemiologist by profession. I've got a PhD from the University of Sydney in Australia. I've got a master's degree from the University of Edinburgh in Scotland, and my first degrees in environmental work environmental bachelor's from British Columbia. So a very, very different road. I have more than 20 years of experience doing all types of projects, both applied and research. And I've touched things like the Vietnam War, industrial deafness, musculoskeletal problems, the impact of bereavement. The list is long. What I think is also important is I realized that a lot of life experiences actually color or shape the way you think. So not only just if I can say, not only just my professional degrees, if you wish, and my professional work, but I've spent 10 years in Australia. I spent a year in Africa, traveled Turkey and Iran. So it gives you it gives the view of the world, which is a little bit different, right? And I'm bilingual, French and English. You'll see I'll have some difficulty sometime with my English. So here we go.
No, that is amazing. Such a great background to start this off with. I'm super excited for this conversation and kind of wanted to touch on a couple of things that you actually just introduced. Starting off with, could you please share more about your experience with the Australian Army during the Vietnam War project and how that contributed, how you contributed to improving veterans' health?
Yeah, if I was to name, I have four really projects that to me were major in my life, and the Vietnam War was one of them. It was obviously it was a male-dominated type of project, as you can imagine. The reason I ended up with it is because I had no bias. I had no idea what the Army was like. I had no idea what the war was like. But I just spent a year in Africa, so I'd seen some war scenes from spending time in Africa. And this project was looking after 20,000 veterans who had returned from the Vietnam War and looking at how their risk of mortality, was it increased from having been in the Vietnam War? So I ended up being classified secret with the Australian Army. This was done in Australia. And building a combat index, trying to explain that we saw an increased risk of mortality in men which were in their 40s. They shouldn't have had an increased risk of mortality. So we were trying to explain it, and the combat index that I built explained this. So what this led to in terms of helping the veterans is some psychological support. And you've got to think that in the 90s, this wasn't a typical avenue to support anybody in the Army with psychological support. And as well, giving them better preventive support. So it led to that type of results, if you wish.
Wow, that would definitely be a top. I feel like if I had that experience, that would be a top in my career. That is something I feel like you never expected that would occur, but wow, that is, so did you feel like your experience with Africa, being in Africa, it really helped with this experience as well?
You know, this particular project was actually advertised, and there was 100 applicants for it. And I think I got the job as the lead, the PI, the principal investigator. I
Mhm.
think I got it because I could speak of the war. I had seen war scenes, which I won't describe because some of them are pretty harsh, but I'd seen that in Africa. So I had a feeling for what that could mean for a
Mhm.
veteran. I had a feeling what that could mean for the population around, and yet I had no bias,
Right.
right? So that's why I think I got that particular PI position,
Mhm.
right? It was actually given by the Prime Minister of Australia at the time. There was three departments involved in this: Health Department, Veterans Affairs, and
Mhm.
the Ministry of Defense.
Mhm.
So it was a contract given out by these three departments.
Wow, that is so interesting to learn about, and that's well, congratulations first off for
Yeah,
being chosen to do that, and also just everything that I'm sure the hard work that went into
yeah.
that is
And
amazing.
And just a note, just out of curiosity, because I was traveling in the army and I had to learn so quickly about the
Mhm.
Vietnam War, the different units, their displacement, how was combat conducted and stuff, I was constantly chaperoned by a man.
Mhm.
So there is no way I could have done this work without being chaperoned as a man, with a man. So that, it shows you the woman-man relationship, if you wish, in a
Right,
situation with the army, right? At the
right.
time. It's probably different now, but at the time.
Right. And but do you feel like that although there may have been some biases against you, being a woman in this male-dominated field, how did you handle that? Was it easy for you to kind of like put that aside and focus on your work?
I think that as soon as I showed that I understood what had gone on, where the units were, that bias just went. So the introduction needed to be done by my
Mhm.
chaperone, right? But as soon as I showed that I had the knowledge, and that's what I realized in everything that I do in health tech. When
Mhm.
you show you've got the knowledge, the bias goes away. In my case, it does mean that applies to everybody.
Right.
I do know women, for example, who only raise 22% of the of investment available out there for startups, for example. So it doesn't apply in every case, but in these particular case, as soon as you show you got the knowledge, the bias, in my case, went away.
Good. Well, that's good to hear. And again, congratulations so much for all your hard work
Yeah.
that you did on that. I think it's so interesting to learn about and almost a small world because I mean you've been all over the world, but yet I'm here talking to you about it. So I love that. And also I wanted to talk about what inspired you to go into the study of work-related musculoskeletal disorders and what impacts did your findings have on workplace
Yeah.
safety and health?
That's the second one. You're in my top four, and that's the second one in my top four. This was a fantastic. This is what inspired me is the need. We're
Mhm.
talking about like maybe 15 years ago. Employers did not recognize that the work environment and the tasks that many workers had to do
Mhm.
led to any type of musculoskeletal problems, what we call work-related musculoskeletal problems. And this is upper limbs and lower limbs.
Mhm.
And this was an international project. It was brilliant. We were working with people from Sweden, France, Finland, the United States, Canada, and we
Mhm.
were all a bunch of experts putting all the literature together to show if there was a
Mhm.
link between the work and the different types of problems. So we looked at shipyards, we looked at manufacturing, we looked at slaughterhouse, we looked at scissor making. Everything that was in the literature, we looked at all the jobs that had been studied in the literature, even singers,
Mhm.
because they have repetitive injuries with their vocal cords, and teachers. And so we looked at all the literature, went through it, showed if there was a link at that point in time or not. So it's like doing 1,000 guidelines for, like
Right.
one disease, one disease, one disease, one disease, one disease. Because we were looking shoulder, we were looking elbow, we were looking at knee,
Mhm.
and we put all of this information together. And at the end of that, I think it was quite clear that quite a few of these disorders were linked to work. And we also, in the same breath, prepared an approach to seeing if there is a problem in your enterprise and how to solve it. And I have to tell you, 10 years after writing that book with all these experts,
Mhm.
somebody still in a party said, "Oh, you're Lina Forcier." And they
Oh,
said, "Oh, I still use your book for the approach and break down my work situation to help to help manage or organize work in a better situation." So obviously that helped a lot of workplaces.
Yeah, no, that's like, wow, that is so you were really passionate about this, obviously, and was able like I can't imagine how many, different things you had to write down and
Yeah,
research and study and compile for that.
yeah, yeah.
Wow, that is definitely I would say would be in one of my top as well from that. That's amazing. And I kind of wanted to cover, I guess, more so the elephant in the room here about Factually Health,
Yeah,
because you are the CEO and co-founder. And by the way, Lina applied to our Breakthrough Alliance Challenge, and she was a finalist
yeah.
for our fall. So yes, congratulations again to that. And so I encourage anyone else on the audience who has an innovative health solution to apply. We currently have applications for that, but I want to, ask, how does Factually Health patient information platform help leverage AI to provide accurate and reliable health information to healthcare providers and their patients as well?
I guess you already figured out that I'm passionate about health. I'm
Mhm.
passionate about patients or employees when we're talking about occupational health and safety. I
Mhm.
had the French word in my head. And for me, what we're building is a total platform. It's a way to make it to, it's the way to help the health industry support their patients,
Mhm.
right? We think that what patients are is 8 out of 10 people go online to search for health information,
Right.
right? Just another statistic, which I think is fascinating. Almost 50% of us take either supplement or vitamins to help
Mhm.
us with our memory, and only 5% have spoken to the doctor about this. So it
Mhm.
shows you that our main way of getting informed is using the web. As an epidemiologist, for years I've had patients reaching out to me with really important diseases, and they're about to make major decisions with the wrong information. So I thought
Mhm.
building this platform was really important. I know how difficult it is for the health industry, even smaller places, to keep their information up to date on their site. And the thing is, patients will not stick to one site. They'll search. Their need, I don't know if any of you have ever had a bad diagnosis, but when you get a bad diagnosis, you didn't understand half of what the doctor said, if not
Right.
3/4 of what the doctor said. You'll go to the web to secure
Mhm.
you, to make you understand, to take your time to integrate this information. And so therefore we felt that there had to be a way to help patients search only for factual information and provide those tools to the industry. So we're using a mixture of automated as we scrape the web and get only the factual information,
Mhm.
and we're putting AI in there. So we've built a search tool. I'm currently building a conversational agent, and so we've got a variety of tools are in this platform to really help patients, empower them through their health journey, and
Mhm.
help the health industry help their patients. If that made any sense to you.
Yes, no, no.
You
As
know
you were
so much
saying that,
stuff.
I was like, I kind of wanted to raise my hand because it's like, how many of you have Google, you have a symptom and you're like Googling it and see what's wrong with me? How many times have I taken a supplement and not told my, physician
Yeah,
about it? Yes. So if there's a platform where I could literally go on and know that I'm getting factual information
yeah,
and feel that sense of comfort when
yeah,
researching it, I think that would be an absolute game changer. Because doctors will kind of to tell you like this, and they give you these big words, or they write it down, and I'm like,
yeah,
yeah, and then I go home and then I have to look it up myself, and then some websites it's saying, you may only have like this, and this to do, and someone's like, this is really severe, and so I'm like, well,
yeah.
what's going on with me? So I think that's amazing to have a platform where we could like go on and just know we are getting factual information. So hence the name Factual
Yeah.
Health.
Yeah.
Um,
And
so
what I
yeah.
would say, when you think about it, honestly, what's happening is that there's terrific organizations out there in health. There's terrific companies in health,
Mm,
and the patients go and search the web. So these companies and organizations are not even seeing what their patients are searching for.
right.
This is we'll name the elephant, as you call it. We'll name Google. This is what
Mhm.
Google gets, right? And now a couple of generative AIs are getting. So the enterprises, the organizations that have to deliver services to patients don't see what their patients are looking for.
Right.
Whereas if you have a tool like ours, at least they're seeing and they can help these patients better. Like
Right.
we did an arthritis a test with arthritis, and they saw that patients were looking for exercises, right?
Hmm.
And so this arthritis foundation now is going to be doing not webinars, but exercise sessions
Mhm.
online to help the patients because they see it now,
Yeah.
right?
Right. I was gonna ask you if there's been any specific case studies or examples, but I wasn't even thinking of that either. That if you could see what your patients are researching, you know how to help them firsthand.
Yeah,
You can literally create webinars, research articles right
yeah,
to their phone or mobile device or whatever they're
yeah,
using, instead of having them go out on their own and getting all this false information. So
right.
yes, yeah.
Yeah, and when you think of the time, like I've got lots of friends who are clinicians,
Mhm.
and the time that they waste, and it's a terrible way to say that word. It's not
Mhm.
waste because it's a rapport with a patient, but the time that instead of talking about the disease or the treatment, they're debunking information, right?
Right.
So they haven't even explained how to, how to take the treatment or how to do it. That they're
Mhm.
saying, no, you cannot take ginger for this condition, right? And this is the reason why.
Right.
So yeah, exactly. So it's a tool that helps the clinicians, but as well, they get to see what their patients' needs
Mhm.
are.
Right, firsthand. Yeah,
Yeah,
and also talking about the topic of accuracy, and like relevance of the
yeah.
information. How does Factually Health engage within the healthcare industry to ensure that there's accuracy, relevance in the information platform?
Okay. The way we scrape the web is we actually have criteria. For years, there's about 15 tools out there that show an individual how to factually decide that something you're reading is factual. Nobody
Mhm.
will ever do these tools because it takes half an hour to decide if a piece is factual or not. And I'll
Right.
give you just an example. Is the authorship appropriate? Does the person have the right degree? Well, we've
Mhm.
built a platform where we automatically take all these criteria and we go through the web and exclude everything that doesn't suit these criteria. So therefore, automatically we end up with a factual data set. The other thing we do is we exclude anything that's older than 3 years.
Mhm.
And most patients, like if I look at the web, sometimes I'm reading something which is 7 years old.
Right.
And science goes so quickly. 7 years old, no wonder you're confused. This piece says that and that piece says that, but science has changed in the meantime, right?
Mhm.
So we exclude everything that's older than 3 years old. So that way the patient gets fresher
Mhm.
information and they get factual
Yeah.
information, right?
Well, that's something I don't think I even think of either when I'm researching something is how old this article is. Because that makes a huge difference in terms of how old the data is, if
Yeah,
there's new data, if there's new tools, strategies
yeah,
that has come out. And
yeah,
as someone who helps work in innovation, you would think that would be something on the top of my mind. But actually, I don't think I've ever, really sat down and been like, well, how old is this article compared to this one?
yeah.
So yeah, that is a huge factor that I feel like a lot of people, even not even in a healthcare background, would miss.
And
So that's
and
great.
And you know what, Ansley, what we're aiming for in our roadmap, which I'm really looking forward to when we do it,
Mhm.
and we're talking women's health a little bit here, right?
Yeah.
So, like last week, I was reading something about vitamin D, and I thought, well, how many women were in that cohort?
Mhm.
Because depending on how many women, we metabolize it very differently, right?
Right.
And so, for me, in time, what I'd love to be doing with our tool is when a woman search, being able to give her first the information where there were women in
Mhm.
and how, like the proportion was 50-50 or
Right.
sometimes even higher than that. And then the rest of the information where we don't really know what type of group there was. So to
Mhm.
me, these are really important tools for the future.
Yeah, and I was actually going to ask that too. Like, what ways does Factually Health, its platform, tailor it to address specific health disparities or demographic considerations? Do you have a way that y'all will kind of sift through
Yep.
that?
Yeah, I don't know how many people on the in the audience know this, but in the United States, there's only 37% of the population which has what you call a college degree, right?
Mhm.
And the literacy level is in health is much lower than that. So the way we've done this tool is very much we support the NIH and Santé Canada, Health Canada
Mhm.
guidelines, which say you must tailor your material between sixth to eighth grade. So we actually have different parts of our tool. The first part is something which is tailored from sixth to eighth grade. It's very simple. You ask a query and it's a very simple information
Mhm.
return. And you've got the option of rephrasing it. You have the options of going more complex, right?
Mhm.
So that's like a summary of information. And then the rest is really what you would find as Google would give you in the on the web.
Mhm.
But the first part is really tailored so that it's accessible to most people who don't necessarily are not part of that 37%
Right.
can read anything. Because even if you look at what the CDC produces, Cleveland Clinic produces, it's all, I test the level of readability
Mhm.
of stuff constantly, and it's all college level,
Mhm.
just about, right?
Mhm.
So we've prepared a part of our tool so that it's accessible to more people.
Absolutely. That's another thing also that I feel like, you don't tend to think about either, but just kind of going back to our initial conversation with just what the doctor will tell you, they give you like this long list of the, the medical terms that are Latin
Yep,
based and I'm just sitting here smiling and being like, yep, yep. And then I go and have to Google it afterwards. But you don't think that of like how much of that information that we find it may not even be 100% readable to everyone
yeah,
either, and that can also create a barrier in and of itself, even
yeah,
even doing a search tool like that.
yeah,
um
exactly.
but that's I feel like you have so much of this thought out. Of course you do, but just it's kind of blowing my mind in terms of all these different factors that have to go into it to be able to create a platform like this. And I think a big question that I have, that's kind of around AI specifically, is how are you ensuring the privacy and security of patient data while using AI in the
Yeah.
platform?
For us, our AI is limited to our factual data sets. So it doesn't go onto the web ever, ever, right?
Hmm.
So that's the first thing. The second thing is right now we're ashing everybody, and that's a tech term, but anybody who comes on and uses our platform, they get a special code which changes every 24 hours. So I
Okay.
don't even know if that person has returned this in time when we're more when we've grown. I may find a way that we can still do it and protect everybody. But right
Hmm.
now, I've got so many barriers that I want to make sure our patients are protected, that we're really, really stringent in
Hmm.
terms of them being capable of us being able to recognize who they are. So let's say, like with the Arthritis Foundation we did the work with, they saw what the patients were looking for, but they didn't know if it was a woman, they didn't know if it was a man, because we're really putting barriers there right now. When we grow, we will be able to deliver a little bit more, still protecting the patient. As an epidemiologist, that to me is the first thing,
Right.
right? So we're making sure we're staying within our data sets, that the web doesn't see any of what we do, and there is no access outside.
Yeah, absolutely. Because yeah, I feel like that's, just the kind of the big question with AI recently
Yep,
is the privacy and security of patient data. So
yep,
addressing that, is always crucial to just to have peace of mind for all of your
yep,
users that use the platform.
yep,
But I'm literally, it's honestly blowing my mind like how much of the in-depthness of this platform and how I feel like I wish I had this 5 years ago or 10 years ago or so.
yep,
It's something that I feel like we definitely need, as the web has just become the like end all be all source for many people.
yeah.
And we actually have a question from our audience that I wanted to ask you. So Sue asked if Actually Health collaborates with other industry groups or experts, and is this the overall collaborative process?
It is a collaborative process. We've learned, like I'm collaborating with two breast cancer. I should say our tool is disease agnostic.
Mhm.
So we can within 20 minutes to 2 hours, we can do any disease.
Mhm.
So depending on what we're working on, we're collaborating. So right now we're collaborating for breast cancer with two foundations. And one of them, we may introduce more factual information in genes because the population, their community has got concerns about genes, for
Mhm.
example. So everything we do, we learn. It's a two-way road, I think you
Mhm.
say in English. We learn from the community. We learn from the organizations and the enterprise because they're the closest to the patients. So
Mhm.
we're learning what the needs are, and then we go back. Like for instance, I was asked recently about validated apps.
Mhm.
And we won't do validated apps because I consider it's a way, it's a very involved projects, but I know two companies who do, and I'm negotiating with one to being able to offer validated app because our platform, I want it to be more than just a search tool,
Right.
right? I want to really be the platform that patients can use to go from point A to full health or better health, right?
Mhm.
So apps are part of that. Apps are part of the journey, not just finding the information. Sometimes it's a remote patient monitoring app. Other times it'll be a therapeutic app. So it really is like, as I say, collaboration with communities, because that's the only way you can really do a good platform for patients, I think.
Absolutely. Absolutely. Yeah, the collaboration aspect is huge in so many different aspects of healthcare, but
Yeah.
especially this. And we are getting close to time, but I have two more questions that I want to ask you because I love this so much. What strategies do you employ to educate the healthcare professionals and patients about the benefits and proper
Okay.
usage of the platform?
Okay, for patients, make it as simple as possible. Reach them where they are, right?
Mhm.
And so, like for instance, we've got a request potentially for another country. It's going to be adapted to that other country. You want to make it simple for patients. It's bad enough to have a diagnosis. It's bad enough to be worried about whatever your health problem you have. You want
Mhm.
to be able to just access something. You're used to Google or you're used to a chatbot conversational agent. You want this, right? So it's for patients, it's making it as simple as possible. For clinicians, it's a longer road because obviously they've never been used to this type of tool, right?
Mhm.
So we're very much an innovative type of approach. They're used to putting a standard web page on either their hospitals or either on their clinics, or in a clinical trial, they'll give a standard web page. So
Mhm.
what we're doing is we consider that what a clinic has or what a hospital has would be factual information. And we're building a tool right now because we've been asked that, to integrate the content they already have.
Mhm.
Because they did the work, they want that to be privileged, right? They want the work that they've already done. Let's say you asked what's breast cancer and they've already got a web page on that.
Right.
Well, we would privilege the work that they've done, but then whatever query the patient asks, which they don't have an answer to, then we give them factual information.
Mhm.
So in terms of when you say educate, I think it's a different way of doing things. We're offering search tool, conversational. We're offering a way to search the factual web, and they've not been used to that. They've been used to producing content.
Right.
So it's a learning curve here, right?
Absolutely. And again, I think this is so great. And I think it'll be used more so as we continue into the future, that this is going to be something that should just be the standard.
Yep.
That, providers can say, hey, use this platform if you really want to, if you have other questions, additional,
Yep.
like I can see it, we can connect afterwards. It's really just going to be able to help add that virtual aspect and really help create more value-based care and just
Yeah.
more, definitely more customized care,
Yeah.
everything in the future. So,
Remote patient monitoring, right?
mhm,
I mean, honestly, they're going to go to the web if you don't help them. So,
absolutely. No, I love this is definitely innovation at its finest here and talking about how we can move forward and into 2024 and beyond using a platform like this. So
yeah,
I want to first off just again congratulate you for all the success you've had in your career. It was amazing to sit here and listen. I wish we had more time. I want to ask one more question though, because Nina, this is Nina's favorite question. As you know, Nina's our
yeah.
regular host. So in her honor, I have to ask this to wrap the session. Do you have any words of advice for your younger self or any younger
Okay.
audience members out there?
Which part of my younger self? Which period? No, no.
I guess pre-career, pre-everything.
I would say, I would say that for me, I will aim talking to myself as my kids are just hitting the 10-year-old, 12-year-old, and I'm considering going back full time into my career, right? Not
Mhm.
just taking projects here and there, but
Right.
really full time into my career. And there are three sayings that I wish I would have had. You miss every shot that you don't take, and that's a Wayne Gretzky. Do I show I'm Canadian here? So you miss every shot that you don't take. If you don't ask the question, the answer is already no. And whenever I'm not sure about something, I always remember, now, if you're not asking, the answer is already no. So you've got to go and do it, because I don't know how many other women are on the call here, but a lot of us have got this thing, oh, I'm going to look stupid or,
Mhm.
whatever. So I've got these two saying in my head. And the last one is actually Theodore Roosevelt, the man in the arena, which I call the person in the arena.
Mhm.
And his a long speech, but it says the critic doesn't count. It's the people who are in the arena, and anybody who's in innovation is in the arena. And if anybody here knows Brene Brown, she adds to that the cheap seats around the arena, you can listen to them, but you don't internalize them because they don't know what it's like to be in the arena.
Right.
Right. So all the critics that are sitting in the arena, you listen out of politeness, but you can't internalize what they say. So I would end on that. We're over
What
time.
a great way to end that. And I just want to say that you have gotten so much love in the chat. There's been so many emojis that have been popping up over my screen. You have a lot of love saying great advice as well in the chat. So Lina, thank you so much for your time today, for sharing your expertise and your background. It's been a wonderful and really fast 30 minutes have just flown by today, but it was definitely one of my favorite parts of today. So thank you so much, and look forward to hopefully having you on another Hit Lab event in the future. And again, everyone, make sure you apply for the Breakthrough Alliance Challenge like Lina did as well. So thank you again so much, Lina.
Thanks, everybody. Have a great afternoon if you're on the East Coast. Bye.
Bye-bye, Lina. Thank you. I just want to
Bye.
let everyone, to remind everyone to join us next week. Nina will be back next week. Also, thank you to our sponsors, FFF and Good One. And again, one more last huge shout out to our guest, Lina. Thank you again for your time today. Thanks everyone for watching, and we will see you next week. Have a good one.